Psych and Film Assignment, Movie to the Bone, presentation by Yasmine Grant. Description. In the movie To the Bone, the main character's name is Ellen, and she is suffering from anorexia nervosa. Ellen is admitted to the doctor's care, and she continues to get worse, then gets better in the end. The main setting of the film is a rehabilitation center Ellen is admitted to, along with other patients with eating disorders. Throughout the film, it shows external scenarios on how Ellen's family has become extremely stressed by the situation and how Ellen's condition worsens as her mental state worsens. Diagnosis. In the film, Ellen is diagnosed with anorexia nervosa. Anorexia nervosa is an eating disorder and psychological disorder characterized by intense self-starvation due to fear of being overweight. Patients with the condition refuse to eat or only eat in small amounts of food. The main character is from Los Angeles, California. With this cultural information, there are resources available that the family of the patient is utilizing from the beginning of the film, and she has been clinically diagnosed with anorexia nervosa, therefore proper treatment is being sought after. Regarding culture, this disorder is statistically more recognized among Caucasian women in first world countries due to societal norms that being skinny equates attractiveness. In the United States, the rate of people of color being diagnosed with anorexia nervosa is increasing when compared to previous decades. In other cultures, such as third world countries, for example, Africa, being skinny is frowned upon, and being slightly overweight means a person comes from wealth, and therefore they are more valued in society. Stigmas associated with anorexia is the disorder only affects adolescent women. It can only happen to Caucasian women. It is simply a diet gone wrong, and the person suffering from the disorder has full control over the disorder. All of these stigmas have been statistically proven false. Anorexia is more common in women. However, men and women of color can have the disorder as well, and anorexia is also a mental condition that cannot be fixed overnight. Evidence. In the movie, the main character gets evaluated by a doctor specializing in eating disorders. She is shown to have lanugo, which is a common symptom associated with anorexia. Absence of menstruation, extreme thinness, fatigue, dizziness, slow heart rate, bruising, and body dysmorphia, as well as depression. These symptoms are shown in multiple scenes. In the film, Ellen is constantly wearing warmer, baggier clothing. However, there isn't much evidence showing that she suffers from being cold like most anorexia nervosa patients. Therefore, I would say the film does not properly portray this symptom. Treatment. If I were Ellen's doctor, I'd look at her physical condition and see how severe it is. In the film, she is deemed extremely severe and on the verge of death. Therefore, I would hydrate her via IV, give her vitamin supplements through IV, and put her on a non-permanent feeding tube. I'd also admit her into a rehabilitation home. This medical treatment has some ethical issues, as it may come off as extreme and may worsen Ellen's depression. However, it is necessary since she is in such a fragile state. I understand the doctor taking a calm approach in the film. However, Ellen's condition actually worsens throughout the film until she decides to make it better. The situational barrier that this character has is her past resistance to treatment from other rehabilitation centers in the past. She has been given calories through IV as well as hydration. However, she has continued to starve herself and has walked out of rehabilitation centers since she is an adult and can refuse treatment. She has also refused to take in antidepressant pills that past doctors have given to her. I understand that there is a non-invasive approach that her more recent rehabilitation center has taken. However, it's too much of a risk in her fragile condition. Broader perspectives. The film does accurately portray the symptoms and how it can affect others around the patient suffering from anorexia. However, it doesn't do a great job of portraying the mental struggle of the patient. It's obvious that she has depression, body dysmorphia, etc. However, they could have gotten in better depth with her thought process behind the disorder, rather than portraying her as being ridiculous and just showing that she's dying. In her eyes, she's not dying. I wish the film portrayed why she thinks she's not dying and that she thinks this is okay. Sources / picture credit.